Okay, so let's move away from our authors for a minute to talk about who's practicing medicine in Rome. And here I'm going to try to quicken this up a bit. You had a real combination of people offering healthcare, starting with traditional type practitioners. These are people who may not be literate, and that's not considered a problem for most Romans. In fact, not even upper class Romans require literacy. It's considered sort of a fancy, posh move to be like, yeah, your doctor has to read. And we tend to be like, ugh, about that. But that's showing our own bias a little bit. These are people who served apprenticeships, who had a lot of firsthand experience, and who could be very technically proficient. And that is a way that medical information is still passed down, right? We don't just let people learn medicine out of a book. We make them go to med school, and then they have to do a residency, and then they have to like pass practical exams. We never would let somebody be a doctor without making sure that when their hands are on a patient, they're gonna be able to cope. So when we look at traditional practitioners, we should be a little cautious to dismiss them outright. For most of people in the ancient world, this is who their doctor was, and this was standard of care. But religious adjacent people are also part of healthcare. Still in the modern era, religion is a part of the full social context of health. Your belief system dramatically influences the way you understand your body when well and sick. It mediates the way that you cope mentally with the experience of sickness, physically and mentally. In the ancient world, religious professionals were part of the first line responders for healthcare, both mental and physical. Dream interpreters were also a part of diagnosis. In fact, doctors would regularly consult with a dream interpreter or ask the patient about their dreams as a way to get at a diagnosis and to hone in on prognosis. And this is a period where they still aren't quite sure where the mind-body connection is, and they take a very holistic view towards that. As I mentioned, free Greek-identifying physicians are pretty active in the Roman world. Not necessarily just in the upper crust either. It seems that there's a real preference for people with Greek-sounding names as practitioners of medicine. This doesn't, however, mean you're from Greece. In fact, only a small percentage of people with names in the Greek language were from mainland Greece. A lot of them were from southern Italy. There were a lot of Greek-speaking colony states in southern Italy, southern France, bits of Spain, North Africa. Many, in fact, most of our medical authors in this course are not from mainland Greece writing Greek. In fact, I think all of them are from the Near East, Anatolia. Galen, he's from modern-day Turkey, Pergamon. That's still one of the powerhouses for medical training and medical knowledge. Kos, the putative home of Hippocrates, is right off the coast of modern-day Turkey. So this remains a place that's strongly associated with good physicians. But it's not just Greek-identifying physicians either. Egyptian physicians were also felt to be very effective, and a lot of them also spoke Greek. So you had this nexus of identities that intersected. Some of these free Greek-identifying physicians who spoke Greek and read Greek and trained in Greek would have Roman citizenship. Some of them would not. And this means that they had a Roman identity as well as a Greek identity that overlapped and bled into each other, and is going to be important when we get to the law bit. Now, a lot of physicians were either enslaved or formerly enslaved, so much that many, if not most, medical professionals at some point in their training would have been enslaved. It's such a regular part of slavery culture that Roman law has rules for how to deal with enslaved people with medical knowledge and training, and how to go about freeing them while ensuring that the person who had formerly enslaved them still benefits from their investment in that person's practice. Once freed, you had some advantages. You got automatic Roman citizenship if you'd been freed by a Roman citizen. This gave you some protection, but also some liability because you still had responsibility to the family of the people who had owned you. They also change your name. When you're freed, you're supposed to take your former enslaver's name. This is a feature of slavery name patterns in the American South too, so we're familiar with this kind of exchange. But what's very different about ancient slavery is there's no systematic effort to keep enslaved people illiterate. To the contrary, you are more valuable if you're literate, and this means that trafficked people are regularly educated, but we should be very cautious about seeing this as a good thing. These are trafficked people being educated so that their traffickers can profit even more off of owning them. That's not a happy thing, I think. I know, I'm going to go to the bad on this one. As I mentioned, these physicians include women. There are female physicians who go by medica, which is just the female version of medicus. Medicus is a doctor in Latin. Medica is a lady doctor. In fact, you're looking at a tombstone for one of them. We're missing her name, but you can see her job title here, medica. And they're more like this. This is how we document that. But OBGYN practices, sometimes you'll see this translated midwife. I don't think this is fair. Unlike modern midwives, they didn't practice with a physician's supervision. They had independent practices that often veered into family practice as well. So obstetrician, OBGYN, is a better rendering of the dynamic here. So these are women who had full freestanding medical practices, and if you were yourself a woman in antiquity, your primary provider of healthcare would likely be another woman. And these women professionals made large amounts of money, enough that they could donate buildings to their hometown. They were very influential in professional guilds, and they did have some perks under Roman law, including salary guarantees. This means that in the Roman world, one of the good news items is that if you were female, you had a pretty good chance of a viable independent medical practice. In fact, women were going into medicine at rates that we don't really see again, at least in Europe, until like the 70s. So there's some good news here. Yay, go ancient lady doctors. You also had an interest in the Roman army in recruiting and training physicians and physicians' aides. So the military medicus, medici is the plural, is a big part of the way you get trained, but also the way that Roman military institutions provided healthcare to frontline troops. This is the beginning of what later becomes the military medic and first responders, paramedics. Romans don't invent this, but they do create a system for supporting, recruiting, and maintaining this. And for a lot of veterans, this does become a path to a professional life after service. Finally, we need to talk about schools or sects of medicine. So this is the last big ticket item in our tour of everything you need to know about medicine going into Roman medicine specifically. These are three major sects or approaches to the human body that were active in the Roman Empire. These aren't the only ways of treating the body, and these aren't mutually exclusive either. A lot of physicians on the ground seem to have combined elements of one approach or the other, but these categories get used to talk about some very different ways of approaching theory, healthcare, and treatment. And they come out of moments that are important to understand what's going on in the theory. So without further ado, let's start with the two older ones. As Greek medicine comes to Rome. So here is the timeline Pliny the Elder gives us for how Rome encountered and incorporated Greek-style medical practice. And it begins in 219 BCE. when Rome decided to do what other Mediterranean cities were already doing. That is, to pay a physician to move into the city and to run a practice out of a facility provided at state expense. So the Roman Senate creates a shop front. They bring in a surgeon named Archagathus from Sparta, and they set him up in a shop. We don't think that they necessarily paid for free treatment. We're not sure, Pliny doesn't say, but maybe there was some state-sponsored healthcare involved here. But nonetheless, it went sideways very quickly because Archagathus had a nickname he acquired in Rome, that is the Carnifex, which is the Latin word for the butcher. This is not the nickname you want when you are a surgeon. Interestingly, he seems to have been respected by his peers. Later doctors quote him and cite some of his procedures, so this isn't a guy who is, on a blacklist for all time in medical history ever after. He might have been pretty competent. But surgery is a high-risk practice in the ancient world, yes? No germ theory. And Roman patients died. And died horribly because of ancient surgery. There were some analgesics, but not anything that's really good or really reliable. Surgery was super painful and super traumatic, and you could die from shock. Surgery before the invention of ether, let alone the invention of germ theory, was extremely high risk with a huge body count. To illustrate, let me tell you one of my favorite modern medical history stories. That is the story of Robert Liston and the surgical procedure with the highest mortality rate on record. This is not the kind of record you want to get, by the way. So Robert Liston had a 300% mortality rate from a single procedure because when he was amputating a leg, he went a little bit too fast, because back in the day, going fast when you didn't have blood transfusions let you operate so that your patient wouldn't bleed out. But he cut so fast that he removed his assistant's fingers and the patient's leg, and one of the spectators watching, because surgery was often a spectator sport, had a heart attack and died. So a spectator died, his surgeon whose fingers got cut off got gangrene, he died, and then the patient also got gangrene and died. So that's the 300% mortality rate from a single surgery. One patient, 3 dead people. Good job, Liston, good job. Despite that, he was really well respected. He's actually a pretty good surgeon. Just, it's hard to live that one down, isn't it? Oh, Robert Liston. I say all of this to illustrate why things would have gone badly for Archagathus, because remember the social context he's practicing in. He's a Greek, he's a Spartan, he's practicing in Rome, the Senate went out on a limb and sponsored him, and patients start dying, and people like, say, Cato the Elder is alive for this, so, oh dear. You see the problem. Yeah. It goes sideways. Archagathus is driven out of town, and Roman doctors have a really hard time coming back from this ever after. In fact, in the years 161 and 91 BCE, the Senate actively expels Greek intellectuals from the city of Rome, including all the doctors. They just round them up and kick them out of the city. They come back almost immediately, but the fact that Rome is getting this hostile tells you a lot about the practicing conditions. Now, in the middle of this, however, Rome tries again with Asclepiades of Bithynia. So this was a teacher of rhetoric who switched careers midlife to become a physician. But this shouldn't make you immediately think he's sketchy. This is not unheard of for ancient intellectuals. And he was headhunted by a number of royal courts, including the one of Mithridates of Pontus, who was Rome's public enemy #1 at the time. So Rome poached him. They got him to move to Rome instead of to Pontus, and they bragged about it ever afterwards. So when Asclepiades went to Rome, he had an in that a lot of other Roman doctors didn't have, because he was letting Rome get one over on a foreign enemy. Now, the other thing Asclepiades did that was clever is he came up with another approach to the human body and medicine that worked really well in the social context he was practicing in Rome. And that is an idea that the body may include humors. So he believed that, yeah, there are humors, but the important thing is not so much the fluids that are in the body or how they're mixed or where they are. It's about how well the flow within the body is working. How well are particles moving from one part of the body to another? Are they getting blocked up? Are they moving too quickly? And how do we rebalance them early? How do we intervene before something gets to be a bad disease? From this idea, he comes up with one of the best ideas ever to hit medicine, the idea of passive exercise. That is, putting the patient in a hammock or giving them a massage or putting them in a nice warm bath in order to affect the flow of particles through a part or the whole of their body. So because you're trying to get the particles to flow more freely or more slowly or just balance out, the ways you do that would be by like rocking the body and shaking it and settling your particles in your pores, heating it, cooling it. All of these are pretty low impact interventions, certainly compared to surgery, low impact. They can have an effectiveness, and they are the kind of interventions that make sense to Romans. Romans also appreciate that they've got this new theory that doesn't sound like the sorts of theories coming out of the rest of the Greek world. This feels more local, more homegrown, somehow more trustworthy. In the 1st century BCE, Thameson of Laodicea is one of Asclepiades' students, takes Asclepiades' ideas and founds a sect proper that he calls the Methodists, which is our 3rd major faction of doctors. So here they are. Their word methodikoi is a compound that means a roadmap or on the road. So this is meant to be a roadmap to health. And it's also the word that gives us method in English is this word in Greek too, methodos. This is meant to be a method, an easy to understand, easy to explain way of understanding and treating the body. So I've mentioned the particle and pore thing. They were very interested in what they called the common features of disease, the koinotes. That is, they believed all disease was characterized either by a flux, a flow that was too fast of particles, or constriction. There was not enough flow, that flow was blocked. And the third state was a mixed state where you're constricted somewhere, you're flowing too fast. In another place, your flow balance is out of whack. Methodist physicians, then, their first order of business when observing a patient was to try to figure out, okay, is this a constriction disease or a flow disease, or like, does it have features of both? Is it chronic or is it acute? Like, is this developing over a long time or is this a serious short-term disease? Depending on which, you're going to intervene either more aggressively or more gently, depending on how much time you have to work with. And then they bought heavily into the idea of graduated levels of treatment. They believed in starting with the lowest impact intervention that was responsibly viable. So this doesn't mean they didn't ever just start with surgery. If they felt that it was serious enough, they would. But their first stop would not be surgery. They'd try regimen and diet and then exercise and then escalate through pharmacy and harder drugs and then finally into surgery and cautery at last resort. This also included a lot of extreme dieting too. I mentioned the passive exercise thing. There was also a lot of strategic use of bathing facilities, which is something Romans loved anyway. Critics of Methodism accused these doctors of just catering to wealthy Roman patients by giving them a medical excuse to do stuff they wanted to do anyway. They thought that this was just horribly irresponsible physicianing, that Methodist physicians were sucking up to wealthy people and taking their money and giving them stupid cures that weren't actually cures at all. Now, one of the main proponents of this view of Methodism was Galen, because guess who Galen's main competitors were for Roman patients? Yes, Methodists. So Galen made it his mission in life to tell you that Methodists were the worst doctors ever. He said things like, oh, they only go to med school for 6 months, they like have this ridiculously short training period, and they don't have any proper medical education, they don't read things, they never dissect anything. This is hard to prove because very few actual Methodists have survived, because after Galen, people believed him, and so they stopped copying Methodists. So we lost so much medical knowledge from that stream because people were like, oh, Methodists, they're idiots, with one exception. Cyrannus of Ephesus, who wrote on gynecology in a way that Galen didn't. He had information that Galen couldn't replicate, and therefore he stuck around. So we've still got him, and from him we realized that Methodists had a lot of really good ideas, actually, and did represent some very innovative players in medical treatment, and also some good proponents of preventative medicine and careful equations of risk-benefit analysis. They were a useful counterbalance to some very harmful practices coming out of dogmatic and empiricist spaces, including radical bleeding. In some cases, medicalized rape is a thing that happened in some treatments for women's health conditions. There's a lot you can say for the Methodists.